breastfeeding is easy. I don't know who told you breastfeeding is easy. Sometimes hospital environment stresses you out. My patients are really happy about home birth, so I'm like, why not? People have been delivering at home since time immemorial. People have been having home birth. Sometimes things do not go as you plan, and it's not your village people, okay? It is just what it is. Hey beautiful people, welcome back to my YouTube channel. This is Succinct Jumi. On this channel I talk about nursing and midwifery, women's health, life experiences, faith, and a lot more. Guys, a lot more. That means there is never going to be a dulling moment in this space. So if you're watching me right now and you haven't subscribed, kindly click on the subscribe button and sign up for premium content. Okay, so in today's video I will be talking about certain myths or misconceptions about labor, pregnancy, childbirth, and afterbirth. Okay, and peradventure you eventually going to see or meet women in this kind of situation. Please do not judge them. Please do not judge. Okay, so number one thing I will be talking about is SVD is the best. What is SVD? SVD means spontaneous vaginal delivery. You know, the normal delivery with the traditional, you know, way of delivering, the Hebrew women kind of delivery. We just have this way of praying, oh Lord, let me deliver like Hebrew women and stuff like that. Guys, while I'm not saying SVD is not the best, I am also not saying it is the best. Guys, sometimes SVD is not the best. So just permit me, for the purpose of this video, I would be saying SVD, SVD, SVD. So just know I'm talking about the spontaneous vaginal delivery. So we have three types of delivery. Basically, we've got the spontaneous vaginal delivery, we've got cesarean section, and we've got the instrumental delivery. So the instrumental delivery is the use of the forceps and ventus. So the ventus is also known as vacuum. Some people call it kiwi, whatever you call it where you are from. It is instrumental delivery. Okay, guys, depending on what your situation is, sometimes cesarean section is the best for you. As a woman, the fact that you've had an uneventful pregnancy, everything has been seamless, has been good and fine, you know, you didn't even have morning sickness, all this throwing up, vomiting, whatever, itching, you didn't have a bit, not even a tiniest symptom of pregnancy. Everything went on as smooth. You could get to the labor room and something else happens. It's not these things, there is no straight way to these things. Sometimes things do not go as you plan, and it's not your village people. Okay, it is just what it is. Sometimes things just change within a twinkle of an eye, and the things you have to do at that moment, it could be an instrumental delivery that would, you know, salvage the situation. It could be a cesarean section that would salvage the situation. So guys, listen to medical advice and go for what is best for you. Of course, we're not going to, you know, shove down into your throat things, do cesarean section, have instrumental delivery. No, that is why we've got consent. You have to consent to these things. So if you say no, you don't want to do it, you have a covenant with God, you are not going to find yourself having cesarean section, doing instrumental delivery, well, no one is going to force you to do it, but you need to know that you put yourself and the baby at risk. So I think it is just reasonable, okay? It is reasonable for you to go for medical advice at the point when you need it, okay? Sometimes cesarean section is even, you know, long planned. Some people have previous bad vaginal birth experiences, okay, and for subsequent pregnancies they just say no, they are opting for cesarean section. So if you meet this kind of women, what do you say? You say, oh, why are you opting for cesarean section? Oh, it is, oh no, guys, let people do what is best for them. Let people do what is best for them, especially in matters about labor, delivery, because honestly, I think labor experience is like one step away from death. You could survive it, you might not survive it. it's like it's something excruciating. It could sap life out of you within a tickle of an eye. So why would you just judge someone for taking certain decisions for what is going to, determine if they are about to live or die? Please let people make appropriate decision, and you as the woman rather, if anyone has told you about cesarean, vaginal birth, instrumental delivery, just take it with good faith, okay? And have an open mind towards these things. Have an open mind towards these things. Guys, we are no longer in the Stone Age. We shouldn't even be dragging cesarean matter or SVD matter or no, guys. No. We have moved past that, right? Okay? Then I would not forget to mention that one reason why people do not want the cesarean section is, oh, scar. I don't want to have scar. Excuse you, what is scar? What is scar? Like, if you are involved in a car accident today and you're badly injured, would you not have the scar? No, would you not have the scar? So I ask again, what is scar? And you haven't even seen a neatly, sutured cesarean wound, guys. I have seen cesarean wound neatly sutured that you would not even recognize if there was a previous scar or not. So if it's about the scar, deaden the idea, guys. Deaden the idea. I don't know if permit me to say deaden the idea, okay? So that is that. Number 2 myth is breastfeeding is easy. I don't know who told you breastfeeding is easy. Okay, I'm not even going to lie. As a mom myself, I just felt breastfeeding is something natural. Like, why should you struggle with breastfeeding? People have been breastfeeding their babies since time immemorial, So why should breastfeeding be an issue to you? Why should you be struggling to breastfeed your baby? It's your baby. Is it not just to put baby to breast, position the baby, and so I thought. I'm serious, guys. So I thought, until I got here in the UK and I saw how women struggle with breastfeeding. Guys, if you have been used to certain exposure all your life, you wouldn't even know what other people are struggling with. You wouldn't know that these things you see as very easy, these things that come so natural, thousands of women, in fact millions of women, are struggling with it. Okay? So it doesn't just come easy. I was opportune to be in a gathering of women when I was doing my antenatal rotation as a preception midwife. I was opportune to attend the gathering of women for antenatal class, and women were told to talk about their experience, previous experience on breastfeeding. And guys, you see people trying for 2 months plus, women that are determined to breastfeed their baby, trying for 2 months, and yet they are not getting it. It's either it's so difficult for them, probably they are not lactating much, they've tried everything possible, they really want to breastfeed but they are not lactating much. Sometimes it's the baby that are not even latching well. Personally, I've seen this firsthand. Why should you put a baby to breast and the baby is struggling to feed? You've ruled out every possible thing that could actually be wrong with this baby, and you cannot even find a reason why a baby should not be breastfeeding. So at this point, what option do you have than to advise bottle feeding, encourage bottle feeding? You see babies struggling with breastfeeding, you see moms struggling to lactate, struggling to put baby to breast, and this particular situation gives them, this kind of mental breakdown. They have blues, puerperal blues, they go into depression just because they are struggling with breastfeeding. Guys, breastfeeding can be hard. I don't want to say breastfeeding is hard, but believe me when I say breastfeeding, as natural as it seems, it can be hard. Don't judge it. When you see a woman saying, I am not breastfeeding, I want to bottle feed this baby, can you kindly allow them? Thank you. I would also say this, as much as we feel breastfeeding is the safest, is the most available, cheapest. Yeah, breastfeeding is actually very cheap, cost effective. As much as we feel it's like the best thing we can give to our baby, can you not flog yourself for not being able to breastfeed your baby? It's not a crime. If you are lactating a little, give the baby the little one you're producing, right? I know there is more to this lactation breastfeeding topic, and in subsequent videos we'll find a time where we talk about various things, about, we go deep into each of these topics, right? But for now, let's just talk about the myth, the misconceptions around these things. Okay, so as much as you want to breastfeed, if you can't do that, don't flog yourself too much. You can actually combine feeding method, bottle feed, breastfeed your baby as much as you're sure baby is getting the appropriate nutrients. And there are a lot of formulas now that are healthy for the baby, so do not flog yourself too much. All you have to do is to get this formula. If they are pre-made, good and fine, you save, you can just give your baby directly. And if they are the powdered in powdered form, just follow the steps, follow the appropriate method for preparing them, and prepared in a neat way, in such a way that when you give your baby is still getting the nutrients, free from microorganisms, bacteria and stuff like that. Okay, so that's that for breastfeeding and bottle feeding. So number 3 myth is home birth and hospital birth. I know we believe hospital birth is the best, saves you from a lot of complications, or there is, quick response when you have complications at all. Guys, sometimes hospital environment stresses you out. Sometimes hospital environment add to your stress in such a way that it impacts on your labor process, and which you wouldn't have experienced. You wouldn't have experienced same if you had your birth at home. Guys, this is not me advocating or saying stay at home, don't come to the hospital. No, this is not me doing that. This is just me saying sometimes if you have a very good, low risk history, your pregnancy was low risk, both previous and the present one, and you are fit for a home birth, your midwife is going to tell you whether you are fit or not. So if everything looks fine, it's been uneventful, you're fit to have your own birth, why not? Really, why not? You have your own birth, you feel safe in your own environment. You don't have to leave the comfort or the confinement of your own, sort of feel like they are in their own world, and it just makes things easy. The stress of being in the hospital, reviewing every minute, every second, we cannot even take that fact out. In the hospital, you get reviewed from time to time, especially if it's needed. The obs, it's not as if the obs is not being done at home, but it just makes you feel like you're in your own world. Nothing is taking you to external parts of your environment, if you get what I mean. So home birth is one of the sweetest things. My patients are really happy about home birth, so I'm like, why not have an home birth? Why not? I know from my home country we do not really encourage home birth because a lot of complications might arise, the death rate and stuff like that. But I remember that before I left, the government in my country, there's a kind of they kind of liaise with the traditional birth attendants, those people that do home birth, because I don't think it's a common thing for a midwife to go give home birth. Like, I don't think it's a usual thing as a community midwife back home to go deliver babies at home. You have to come to the communities, the health center, or to the hospital. So the home birth is usually done by the traditional birth attendants. Okay, so I know there was a time the government had to liaise with the traditional birth attendants, just to bring them close, so that when they have deliveries, they work together with healthcare workers, and then they give efficient care to their patients. So this is also just to reduce the mortality, the maternal mortality, morbidity and stuff like that. Okay, so people have been delivering at home since time immemorial. People have been having home birth, And because of technology and every other thing like that, we just felt, oh, hospital is the best, hospital is the best. Fine. If you've had previously, fine birthing process, everything has been fine, so far so good, low risk, why not try home birth? Nothing is wrong with having home birth. Okay, so the fourth myth I will be talking about is labor must be painful. Why should labor be painful? You people say, biblically, we say God cursed Eve, that she has to go through pain, labor, and stuff like that. Guys, if the baby is eventually going to come out per vaginal, it's still not an easy thing. You still have to, you still have to have some screams, some shouts, and some high degree of discomfort, even if you're an epidural. So why should the entire labor process, do you know how long you're going to labor for? If you're going to labor for more than 12 hours, maybe from 12 to 18 hours, or even for 24 hours, so you want to stay in pain for 24 hours, you want to stay in pain for 18 hours, come on guys, stop it. It doesn't have to be painful. It doesn't have to be painful. The idea I had before is you have to go through pain. Like, what you shout, shouts, you guys feel pain. But seeing that you could have it seamless, you could have it painless, honestly, it ticked a very huge box for me. A very, very huge box for me. So why? Why do you want to go through pain? Because that's the way your grandmother, that's the way your mom, that's the way your aunt, that's the way people every woman in your life have gone through the pain. No, I've gotten to that point where when I'm looking after a woman in labor and she's in so much pain, and we try to, offer her different pain relief techniques, different pain relief method, and she's declining, and we mentioned epidural and she's still declining. I just feel like, in my mind, no, this is not me judging them, this is not me saying you have to, or this is not me enforcing having epidural on patient, but in my mind I just feel like, why do you want to go through so much pain? Honestly, that is how I feel. But then I'm still going to manage my patient in the best possible way I can. I'm still going to care for her in a way, just to minimize her pain, to relieve her in a way I can. I've actually been in this kind of situation before, where someone was talking about she's had 4 babies and she's never gone through a painful labor. Rather, she has never gone through a painful labor, and she said, all my 4 children, I never felt pain. I had epidural all through. And someone else was telling her, so you don't even know what you are saying. Then you know they my level. That was exactly a word. You know they my level. Which level are you? Guys, I literally questioned her. I was like, what level are you? Level of pain, right? I think it's a good thing, and I think everyone, like worldwide, I don't know, it seems I'm the only one that felt labor pain. I don't know, but I don't want to talk too much. But I'm like, what level are you? So it has gotten to that point where women start to feel superior to other women who had epidural, because you had a very painful delivery and you felt, oh, I'm the real mom, this challenge, I'm not the real mom, I'm the real mom. So it has gotten to that stage for us where you think, oh, you're the real mom, and people who had epidural, they're like lesser to you. Similar thing to people who had normal vaginal delivery, and they seen themselves as being superior to someone who had a cesarean. No, it shouldn't be that way. No one is superior, no one is inferior. It is just what it is. You do not, if you do not have the opportunity, if you do not have the opportunity to get epidural, it's on you. You shouldn't blame another woman, or you shouldn't see another woman as inferior just because she had the opportunity to have epidural. Okay, so that's going to be that. So the 5th misconception I would be addressing is, you can't get pregnant while breastfeeding. Says who? Says who? The reason why people see exclusive breastfeeding or breastfeeding in totality as a way of family planning or preventing from getting pregnant is when they are not actually seeing their menses, when they are not actually menstruating for the period of breastfeeding. Okay, so when you're not breastfeeding, when you're breastfeeding and you're not having your menses, you're not seeing your menses, it is safe to say you are not ovulating, but you are not even sure when the menses is going to start. What if the menses comes up around the 5th month or around the 4th month, and you in your mind you're thinking you're safe, yourself, and then you get pregnant? Like, you get pregnant with the ovulation preceding that particular menses. So you have a 5-month-old baby and you're pregnant for another one. This is not uncommon. You know, we've had a lot of women who their body are still trying to recover. You know, babies are 6-7 months old and then they are pregnant again. So I am not saying it is not done, and I'm not saying it is totally wrong. Some people actually plan these things, they want it to be so, but you, that you're not planning for your own case to be like that, and you do not put any measures in place to prevent pregnancy, you do not have any contraceptive any contraceptive plans in place following birth, you could get pregnant the following month. And research has even shown that after birth, your chance of conceiving is very high. So every woman who delivers their baby, one of the core things we tell them is contraception. Do you intend to use any contraception at all, or are you planning to abstain? One of these things should happen, else you're going to fall pregnant. So if this is your plan, you want to have your babies, you know, within the space of 6 to 1 year, whatever, you're free. But then we've had people who have gotten pregnant within 3 months of birth, and I'm very sure that is not what they wanted, especially when the pregnancy comes with a whole lot of complications or all these symptoms, morning sickness and stuff like that. So you don't want it. You really want your body to recover. You know, you want to have your time. You want to really glide through postpartum period peacefully, uneventfully, not nursing an infant and then you're heavily pregnant. Might be too much on you. Okay, I'm just saying. But if that is what you want, go for it. I think I've mentioned about 5 misconceptions now. Please go to the comment section, and if you know any other misconceptions that you would like me to talk about, kindly state them in the comment section and I will be there to enjoy reading from you. Okay, and this brings us to the end of the video. If you want me to talk about anything about women's health, anything relating to pregnancy, labor, childbirth, kindly let me know in the comment section and I'll be there to respond to you. Thank you as usual. Thank you for your support. Thank you for always. If you have gotten value from this video, kindly subscribe, click the notification bell so you can get notified for more valuable content.